Okay, so let's get started. The session is about mastering, just mute everyone. Yeah, the session is about mastering giving the diagnosis, how to give the diagnosis properly to the patient without any hesitancy, with all confidence that you can. All right, so we have some cases today to practice on. Are you ready, Dr. Ahmed?
Yes,
All right, so I'm going to share with you the first case. Can you see the first
yes,
example?
yes, I can see.
All right, good. So read your question or read the story. We are going to focus on giving the diagnosis. Okay, this is the skill that we are going to focus on. It's not about doing the station in 8 minutes. It's about giving the diagnosis. We will see how should the diagnosis be given in each specific case that we are going to take. All right?
Okay.
Okay. Once you are ready, start and tell me.
So I don't take any history, right?
No history, nothing. You'll start from the management part, from giving the diagnosis.
Even if I don't know what's the diagnosis,
You don't know what's the diagnosis here?
maybe orbital cellulitis.
Try your best. The patient who has a pain in the eye, increasing with movement, has affection of visual acuity and color vision.
Optic
She
neuritis.
she has a family history of multiple sclerosis. So what it could be? What you
Okay, I can
said?
start.
All
Optic
right.
neuritis.
Okay. So let's see. Start.
Okay, thank you for letting me examine you, Mrs. X. Based on the results of my examination and that you mentioned that your mother has multiple sclerosis, this could be a condition that's called optic neuritis. Do you know what does that mean?
No, doctor, what is the meaning of
Okay,
optic neuritis?
so basically in this condition, the optic nerve that supplies your eye, the one that the nerve that you can that supplies your eye with the nerve nerve supply that for which you can see through, it's having some inflammation around it, and this is causing you to see less, being unable to see it with your left eye specifically, and
Mm,
in addition to that, your color vision is decreased too. Uh,
mm.
this is what happens basically.
Okay. All right. So you told me, doctor, because your mom has multiple sclerosis. Is it related?
Yes, and patients that have multiple sclerosis, you might be having the same condition too, and the most associated condition with the same symptoms that you are facing by now, it is called optic neuritis, which is the inflammation of the optic nerve that's supplying your eye.
Okay. All right. So will I lose my vision, doctor?
For now, we can't say that specifically, but we will try our best with the treatment, and
Mhm.
we will involve the eye specialist with that in order to give you the best treatment that you can receive, to avoid any other complications. Is that all right with you?
Uh, well, okay. So my vision will come again, right?
Hopefully, yes.
All right. Okay, doctor. Okay, thank you.
Thank
Thank you,
you.
Dr. Ahmed. All right. How do you feel
No,
about?
I don't remember the management of the optic neuritis.
Okay. Uh, uh, our focus is not on the management, okay? So
Diagnosis, yeah.
the diagnosis, all right? But just bear in mind, any patient who has acute loss of vision, you have to refer the patient to the eye clinic, emergency eye clinic. Okay? So
Okay.
this is a standard practice. Any patient who has acute or sudden loss of vision, to be a safe doctor, you have to send the patient to the emergency eye clinic. Okay?
Okay.
If you are in the A&E, you will admit the patient and you will involve the
The eye specialist.
eye team. Okay?
Okay.
All right. And this is what are we going to discuss in our revision in Friday, inshallah, in the course. We will have a quick revision on all PLAB 2, inshallah. Okay. All right. How do you feel about giving the diagnosis?
It's good. I believe it's good.
Well, okay, to some extent, to be honest. At first, you were a bit hesitant. Okay.
Yes.
I felt that you are not able to explain what is optic nerve or what is the situation exactly. Okay. But after that, you explained it again. When you explained it again, it was clear for me. Okay. So,
Okay.
to avoid this hesitancy from the start, just put to yourself a specific frame for each diagnosis. Okay. I mean, by that I mean, you tell the patient, thank you for the information that you have given to me, and thank you for letting me examining you. From the symptoms that you have, or uh, explain to her or tell her again the symptoms that she has. All right? She has what? Pain in one of the eyes, let's say the right eye. So you have pain in the right eye. When I examined you, I found that there is decreased vision, or the visual acuity in your right eye is affected. Okay. And when I examined your eye by this specific instrument called fundoscopy, we found some findings. All of these are suggestive of what's called optic neuritis. So you summarize or recap the symptoms that she has with the examination findings. All of these are suggestive of the disease or the condition. Then explain. Okay. What you did is that you told her from the information that you have given to me, or from the symptoms that you told me, and because your mom has multiple sclerosis, I'm suspecting that you have optic neuritis. Well, this is not, a little bit awkward. Okay, she doesn't know what is the relationship between optic neuritis and multiple sclerosis. If I were you, or if I am a patient, if the doctor is telling me because the symptoms that you have and because your mom has multiple sclerosis, then you have multiple sclerosis, right?
Yeah.
Okay, so make it logic. All right.
Okay.
So always, always, always link the symptoms and the examination findings with the diagnosis itself. Okay, you have this and this and this. By examination, we found this and this. All of these are suggestive of this, and then explain. All right, make it a structure for you in giving the diagnosis. By this, you will be confident giving the diagnosis, using credible causes to give the diagnosis. What else? Or the diagnosis will have credibility. Instead of telling the patient, thank you for the information you have given to me. From what you have told me, I'm thinking that you have this. Okay, always summarize the symptoms, explain the examination findings, and then tell her it is suggestive or it is consistent with. All right. So what is the optic neuritis? It's in the inflammation of the nerve supplying the eye. All right. Most probably, or it might be related to multiple sclerosis. You have a family history of multiple sclerosis. One of the symptoms of multiple sclerosis is recurrent inflammation of the optic nerve or the nerve supplying the eye. You had it twice, so you might have it. That we would need to investigate if you have it or not.
Okay.
All right. Is the eye affection in optic neuritis reversible or not reversible?
I don't actually know, but I think it's reversible.
It is reversible. Yes, it is reversible. Sometimes the color vision can, recover with long time, but it is reversible. All right. So this is a model answer for giving the diagnosis of optic neuritis. You have pain in one eye. The examination revealed that the visual acuity in this eye is affected with the fundoscopy finding. All of these are suggestive of optic neuritis, as we discussed. The examination findings, summarization of the symptoms, and telling her these are suggestive of blah, blah. What is optic neuritis? It's a condition where the nerve that connects your eye to your brain, called the optic nerve, becomes inflamed. All right? If you want to add more, this nerve is responsible for carrying signals from your eye to your brain so you can see properly. Because it's inflamed, your visual acuity is affected. The third part of any diagnosis is giving the prognosis. Okay? So the first part is summarization of the symptoms and examination findings. The second part is explanation of the condition. And the last part is giving the prognosis. Okay? It has a good outcome. Lots of cases can recover fully with time, but some of them could have impaired color vision. Okay?
Okay.
All right. So let's see in the next case, how are you going to deal with giving the diagnosis? Any question, doctors? The doctors who are joining us. Any question in this case? No questions? All right. So after explaining that, do you think that you are able to explain optic neuritis to the patient properly?
Yes.
Okay. And the other doctors? Yes or no? Dr. Iman saying yes.
Yes.
Hopefully,
Yes.
doctor.
Yes.
Yeah. All right. Okay. Good. So let's do the next one. If anyone who from the doctors who joined us lately wants to participate, just tell me in the chat box. Okay. Let's do the next one. Once you're ready, tell me and start.
Okay.
Let's say that the patient is Alex.
Okay, I can start.
All right.
Okay, Mr. Alex, thank you for letting me examine you. Based on what you have told me that you have progressive shortness of breath that is increasing with the exertion, and that both of your legs are having swellings. I have examined you based on that and listened to your chest. Your
Okay.
chest showed some signs that are suggestive of what we call heart failure. Do you know
Okay.
what that means?
Do you mean that my heart is failing to work, doctor?
It's something like that. It's just that the myocardial infarction that you had 5 years ago had caused some weakness within your heart. For that, we prescribed you some medications to prevent this from happening. And based on what you said, you have not been compliant with the medications, and that might have been a cause of what's happening now. So that means that your heart is a little bit weaker than normal, being unable to pump enough blood to your body.
Oh,
Are you up with me right now?
yes, doctor. Okay. So, what are you going to do now, doctor?
For now, this is just an exacerbation of what you're having, and it's fairly manageable. We will admit you, and we will involve the cardiac team for that. And it's actually very manageable. But for that, we would like for you to be compliant with your medications and take them on time, because your health is the most important thing you have. Is that all
Okay,
right with you,
doctor.
Mr. Alex?
Yeah. So, will I live with this heart failure, doctor?
It is a condition that's long living actually. It's a chronic condition, but many people are living with it, and they have nearly normal lifestyle, but they are just taking extra care of their health and being compliant on their medications.
Okay. All
Okay.
right. Okay, doctor. Yeah. Thank you.
Welcome.
All right. Thank you. Okay. So, how do you feel in this case?
A bit better than the last one.
Yeah, a bit better. Good. But you use some medical jargons, okay?
Myocardial
Myocardial infarction, so it's heart attack. What else did you use? Use another one. I
shortness
don't
of breath.
remember. No. Something else, but it, it's gone from my mind now. Okay, so you explained to her that she has the patient has shortness of breath, progressive shortness of breath with the examination findings. They are suggestive of heart failure, which is good. You told me that the heart is not working, or
A little bit weaker than normal.
no, you told me this in afterwards, not at the first time. The first time you told me the heart is not working. Then I asked you, so is my heart stopped working, doctor? So you told me no, it's a little bit weaker. Okay.
Yes.
So it's tell her from the start, well, this means that your heart is pumping or working a little bit weaker from it should be. Okay.
Okay.
Other than that, I think you've covered everything and your explanation was good. So if we can correct something, avoid the medical jargon and avoid making confusion to the patient. Stop working, it's not an accurate word. So little bit weaker is better than stopped working. Okay?
Okay.
Yeah. So, if I can give you an idea, I can say this is another idea, but your way was good, to be honest. So you tell her, well, okay, you have a progressive shortness of breath, and leg swelling as well with examination. We have examined your lungs and we have found some abnormal sounds in your lung. To be honest with you, all of these symptoms are concerning me. Maybe your heart is working a little bit weaker than it should be, and this is called heart failure.
Okay.
Okay, you can also add, because it's weak, your body, not your body, there is a fluid built up in the body. When there is a fluid built up in the body, your lung will not be working very properly. So that's why you have this shortness of breath, and why also you have leg edema or leg swelling. Okay, so you can explain more why there is shortness of breath and why there is leg edema. Okay, so you
Okay.
can add that. What else? The prognosis. What is the prognosis? Well, it is a chronic condition, but it can be controlled, right? So you did explain that. All right. So here, this is a model answer if you want to take it, doctors, with you. So heart failure. So I'm concerned about the symptoms that you mentioned. They are consistent or suggestive of heart failure. Heart failure means that your heart isn't pumping blood as effectively as it should, or as it's not pumping blood or it's weaker than it should be. Both of them are right. This can happen if the heart muscles become too weak or too stiff. Okay, why your heart muscles are too weak or too stiff, as Dr. Ahmed explained, because you had a heart attack because you were not compliant on the medication. So this is a complication of that. All right. Heart failure is a long-term condition. While we can't cure it completely, we can manage it very well. You can say that, or you can tell her or him, it is a long-term condition. There is no 100% cure of it, but we can manage it. It is manageable. All right. So there's a difference between curable and manageable, treatable and manageable. Treatable or curable, this means that this condition can be treated 100%. Manageable means that it is a chronic condition, but it can be managed. All right.
Okay.
There is another form. I am concerned about the symptoms that you have. It seems that your heart is weak and unable to pump blood properly. It doesn't mean your heart has stopped working. It just needs some support to help it work better. Okay, so this or this is okay. There is a way that doctors are trying to use. Thank you for, they say, thank you for the information you have given to me. From the information you have given to me, I'm suspecting that you have heart failure. So do you think this way is better, or giving a credibility to the diagnosis is better?
Credibility.
Yeah. All right. So always give credibility to your diagnosis. All right, doctors. Any question in this case, or in how to give the diagnosis?
I'm sorry, doctor,
Yeah.
for interruption.
No.
Is me saying to the patient, because you weren't compliant with the treatment or with your medications, can sound judgmental, or is it okay to say it like this?
Well, that's a good question, to be honest.
Thank you.
So it depends on the way that you give it to the patient.
Mm.
Okay?
Yeah.
Your facial expression and your tone of voice. Okay? If you tell the patient, well, you have heart failure because you are not compliant with your medication, Mr. X. This is a way, okay,
Yeah.
which counted as a rude way, all right? Then the second way, well, okay, so there are many causes of having this problem, Mr. X. One of the causes, or the main causes in your case, that you are not compliant on your medications, unfortunately.
Yeah.
Can you see? It's the same word, the same word, but in a different way.
Yeah.
Okay. If you are not able to use your tone of voice or your facial expression, you can tell him, okay, one of the main causes that you forget to take your medications, or you don't take the medications of this of the heart attack, Mr. X. Okay.
Thank you, doctor. Thank you very much.
All right. Good. Okay.
Mhm.
Let's see if there's any other question. Can I try the next case? Yes, Dr. Fatima. You can try. Why not? Okay. So let's do the next one.
Okay, thank you.
Okay. Can you see the question? I don't want you to see the answer. The patient's name is, let's say, Alexia.
All right.
All right. Once you are ready, start. So remember the structure. We give we summarize the symptoms. We explain either the examination or the investigations if you have investigations, and then tell them what is the condition, explain the condition, and give the prognosis.
Okay, I will try. I will start now.
All right, yeah.
So Alexia, thank you for letting me examining you. And so Alexia, from what we have discussed and we have a chat about what you've been experiencing, that your period isn't regular, and you
Mm,
have got like a lot of, you notice a lot of hair in your body,
mm,
and also you notice some bumbles in your face. This is what we call acne vulgaris. All of this consistent with the blood analysis. I have it here, the hormonal analysis.
mm.
I suspect that you're having a condition what we called polycystic ovarian syndrome. So, are you
Oh,
familiar with this term?
no, doctor, what is that?
Well, I would like to explain it for you in a simple way. So, when every female have got an ovaries, which is normally shouldn't be full of a lot of cyst. When there is some disturbance in the hormones, which are a normal chemical, a normal chemistry of the body, these hormones, when they are a little bit disturbed in their percentage and in the way they act, they will result in some features of having a lot of acne in your face, a lot of bumbles, and a lot of hair in your body. And all this also will result in having absence of period. Uh, so this all we call it, as I said, polycystic ovarian syndrome. And
Okay.
are you following me so far?
Yes, I'm following you. So
Okay.
is there any treatment for this condition, doctor?
So yeah, sorry.
No
So,
worries.
so this condition is manageable, and we can start the treatment. Simply, first of all, we highly advise you to lose weight, and we will see the progress, and we will keep an eye on your condition. We might need to repeat the hormonal analysis again, and whenever we can find that there is a need for medical intervention, we can start it eventually. But the basic thing is we're losing weight. This is I think the cornerstone of management. Are you following me so far?
Yes, I'm following you, doctor.
Do you have any concern right now?
No, thank you. Thank
Thank
you,
you so much,
doctor.
Alexei. Thank you.
Thank you,
I'm sorry
Dr.
for the
Fatima.
inconvenience.
It's fine, darling. All right, so how do you feel?
Um, I think I find a little bit some difficulty in explaining some medical terms. I think
Yeah.
I'm not sure. I'm not sure if I done it in a good way or not. And I wasn't sure about if it is manageable or not, but I prefer to say it is manageable.
It is manageable. Yes, it is not curable. Okay,
Yes.
it is manageable. All right. Okay. So, if I can say something, it's related to how to explain things simply to the patient. You used some medical jargons like cyst. Also, you didn't know how to explain amenorrhea, hirsutism properly to the patient. All right. Okay. So yeah. So let's see how we can explain these medical jargons. Okay?
Okay.
All right. So, what is the simplest word that we can use instead of cyst? Any idea, doctors?
Maybe bag.
Oh, no, not bag. Any idea, doctors?
Swelling or
Sacs. Okay.
sacs.
Yeah, fluid-filled sacs. Okay. If you want to use cysts, you can avoid using the word cyst or the word sacs. You can say the ovaries are not working properly. Okay. So this is a way to explain PCOS. All right. Can you use something simpler than hirsutism? Instead of a lot of hair in the body?
Excessive hair grow.
Excessive, it can be, or appearance of hair in unusual places. Okay, you can use that. You can just avoid using hirsutism if you feel there is something that will affect your confidence in explaining the diagnosis. Take it away. Okay,
Okay.
so you tell her, because you have some symptoms like acne and you didn't get your period and other symptoms,
Mhm.
and we have done some hormonal profile. The hormonal profile with the symptoms that you have are consistent. You can say consistent with or suggestive. Are suggestive of something called polycystic ovarian syndrome, or all of these are consistent with something called polycystic ovarian syndrome.
Okay.
Okay?
Yeah.
In polycystic ovarian syndrome, or polycystic ovarian syndrome is a condition that affects the ovaries.
Mhm.
The ovaries is not working properly as they should be. Okay? Or the ovaries are filled with fluid-filled sacs. And this affects the hormonal balance in your body, causing these symptoms. Okay? So there are many ways that you can explain polycystic ovarian syndrome with. Okay? So either they are not working well, or they are filled with fluid-filled sacs. What else are not working effectively, right? Causing the symptoms that you have.
Okay.
Okay.
Yeah.
So my advice to you, anything that you feel that will affect your confidence in giving the diagnosis, just get rid of it.
Okay.
Make your diagnosis as simple as you can. All right? In the same way, don't make it very simple in the way that it is not credible. Okay? Got me? So either you explain acne, or you tell, summarize you have acne and you didn't get your period with some excessive hair in your body, with the hormonal profile that you have. All of these are suggestive of polycystic ovarian syndrome. Or you can tell her the symptoms that you have and the hormonal pattern in your tests are consistent or suggestive of something called polycystic ovarian syndrome. Right? And always use, if you feel like you are not able to explain the condition, you can always use this phrase. It is a condition that affects blah. It is a condition that affects your ovaries. What happens in these ovaries? In which that the ovaries are not working well. Okay. There was one of the candidates in the course had a problem in explaining the diagnosis. I tried to help him by this way. After a month of practice in the mentor shield practice, this candidate is amazing. Okay, so try to make things simple for yourself and try to put a structure for everything. It is a condition that affects blah, in which blah. Give me an example, doctors. Any example of any disease. Any example of any disease. Write in the chat box or just switch your mic and tell me. And I can help you in just using this structure. Any idea? You don't have any idea in your mind about any medical condition? Let's say a myocardial infarction. Let's say it is a pancreatitis. Yes, it's a condition of the pancreas in which that the pancreas is inflamed. It is a condition that affects your pancreas. Yes, in which that it is inflamed. Okay? Myocardial infarction, it is the condition of the heart in which the blood supply is not going very well to the heart. Okay? So always try to use this way if you feel that you are not very confident in explaining the diagnosis to the patient. All right? Okay, so let's see. Squamous cell carcinoma. Okay. Well, squamous cell carcinoma is a suspected cancer. Okay? Explaining suspected cancer is a bit different from the other medical conditions. Okay? We always try to explain suspected cancer in a sensitive way. So it's a bit different. It's good to tell us this kind of diagnosis so we can help you how to give the diagnosis sensitively. All right. So in squamous cell carcinoma, it is cancer. Okay. Cancer of what? Cancer of the skin. Okay. You don't need to explain what is a squamous cell carcinoma or what is basal cell carcinoma or what is melanoma. It is a skin cancer. Skin cancer. All right. Sensitively, you tell the patient, let's say that the lesion is increasing in size and bleeding. Okay. So Alexia, you have this batch in your skin since 3 months, let's say. Okay. It could be something benign or something related to an infection, but I'm concerned about that. It is increasing in size and it is bleeding. These symptoms are suggestive of something more serious. We don't want to miss it. It is suggestive of skin cancer. And give a pause. Did you see or did you hear how did I play it with my tone of voice? I gave 2 diagnoses. One of them is the benign one and the other one, which is the cancer one. And I gave a pause to give a space to the patient to vent or to absorb the information. All right? Got it, Dr. Amina? How to explain suspected cancer to any patient, any suspected cancer. All right? All right. Okay. Well, okay. So there is a model answer for this one. The hormonal profile with the symptoms you have, as simple as you can, are suggestive of polycystic ovarian syndrome. Polycystic ovarian syndrome is a common condition that affects how the ovaries work, because there are two, okay? The ovaries are responsible of period irregularity. Because if the ovaries are not working properly, you don't get your periods and you experience the symptoms you have. Okay? You can tell her, well, polycystic ovarian syndrome, it's a condition that affects the ovaries in which that the ovaries are not working very well, causing some abnormality in the hormones. This abnormality affected your ability to get your period and the symptoms that you have as well. The prognosis, it's manageable if you would like to say that, or you can say many women live full, healthy lives with polycystic ovarian syndrome. It can be managed with some strategies, and you can just scare her, not scaring, I mean, telling her if it's not managed, what will happen. To be honest, I don't prefer this, but if you would like to add, you can. If you don't want, it's totally fine. You can just scribble this part. Okay? Easy and simple, doctors. I used the medical conditions that are experienced with the candidates, that they are difficult on them to explain to the patient. Okay? From my experience. Will the lecture be uploaded on YouTube? Inshallah. Inshallah. Okay. So let's do the next one. Who is ready? Thank you. Who is ready? Dr. Ahmed.
Should do the next?
Yeah. Yes, take the opportunity. Yes.
Okay.
The mother is Alexia. The child is Adam.
Okay, I can start.
All right.
Okay, thank you, Mrs. Alexia, for answering my questions. Regarding Adam's X-ray, it is showing that he is having what we call a type of fracture in his arm. It's a specific type of fracture that's called spiral fracture. Do you know about that?
Fracture, doctor. No, why does he have fracture?
For that, I would like to explain to you that the spiral fracture usually appears in young children and babies when their arm is forcefully twisted. Do you have any idea about that?
Twisted? No, I don't have any idea. No, why should I twist my child's arm?
I'm not talking about you twisting it. You mentioned that Adam was with his father before the swelling appeared. Is that right?
Are you telling that his dad is abusing him?
That is just a possibility for now. We cannot confirm anything, but for the child's safety, for now, we will admit him and we will involve the social services. Is that okay?
Why do you need to involve the social services, doctor?
This is there is a high possibility for this being a non-accidental injury, and for that the law dictates that we should involve the social services, and forcefully we can admit the child just to keep him safe until everything is clear about what happened.
We are not abusing our child, doctor. What are you saying? I'm going to take him.
I know that this might be a shock for you, but we have your child's best interest within our minds, and with this decision we can actually treat him, and and for him to get better he needs to be treated by the orthopedic team.
Doctor, do you know what do you mean by social services? The social services will take the child from me. I didn't do anything for him.
They will investigate what happened exactly and do what's needed, but if you have not abused the child and you have not neglected Adam, they would definitely not do that to you.
Cannot understand what are you saying. Oh my God. Doctor, I'm leaving and I'm taking Adam with me.
I'm sorry, but you cannot do that for now, and it is within the law that we should admit him. If we do anything other than that, it would be illegal. So I'm sorry, my hands are tied. We have to just follow the law and admit him for now. Do you
Okay.
want what's gonna happen to him in the hospital?
No, thank you.
Okay.
All right. Thank you, Dr. Ahmed. How do you feel?
I don't know. It was not good, really.
Okay. Do you think that if you are just pointing to any abuse or pointing to something that relevant to abuse, will the patient or the relative will be happy?
No,
No. So how we should say that there is an abuse without accusing anybody?
I don't know.
All right, no worries. Any idea, doctors? Any idea?
Can you repeat the question, please?
So how we can explain to the mother that there is an abuse, there is you know, a susceptibility of abuse without accusing anyone.
Uh,
Did-
So first, I will start by asking about the relationship between her and her husband, and I will ask if he's living in the same home with her.
Okay, the relationship is good. Her husband is good. Everything is good in the history taking. Nothing is bad about the husband. The father is his biological father as well.
Okay. I will ask her when was the last time she saw him without this swelling, and who's always taking care of the baby or the child.
Okay, why do you want to know that?
So to consider if she's treating him well or not, if she's the carer of him, and or if the father is the carer of him, if he's treating him well or not. I will keep an eye about if the mother is really taking care of her baby, and if she's in close contact him with him or not. Maybe she's neglecting him. She's working over the night, and she find her baby crying and have swelling in his arm. So the incident may be related to his father. Maybe he treat him badly over the night when she wasn't in the home. Maybe.
Okay, the way that you are explaining this means that you are going to point that the father is abusing the child, right? Not her.
For example, as long as there is nobody other than her and her husband in the house.
So you are going to point to someone. This is what I mean.
Yeah,
Okay.
maybe I did it in a wrong way, but I think the way should be I explain first is this is an unusual fracture, which is usually happen.
Okay, good. That's good. Good. Unusual fracture. which is not common in this age
Yeah,
group.
in this age group, yes.
Okay, then you tell her that this is a routine thing in the hospital. When we see this uncommon fracture in the children, we involve the orthopedic team to fix the fracture, and the safeguarding, not the social services doctors.
Yes, the safeguarding.
Please. Yeah, so please, there is a difference between the social services and the safeguarding team. Okay? The children safeguarding team. We will take an input from the safeguarding team about the incident and what happened. She will tell you, doctor, are you telling me that I'm abusing my child? Are you telling that his dad is abusing him? No, I didn't say that at all. I'm really sorry that you felt that way. We don't accuse anyone, but this is a routine thing in the hospital. If there is something unusual, we tend to investigate more. Why did that happen, and how it happened, and find a solution for your child to make sure that everything is good and fine with him. Okay? So do not ever, never accuse anybody. All right? What is the purpose of involving the safeguarding team? Just to investigate what happened, because this is unusual fracture. They are going to talk with you, they are going to talk with his dad to find out what happened. Maybe there is something causing that, so they can help you with some solutions. She tells you they are going to take my child from me. Tell her, well, okay, to be honest, the safeguarding team, the first priority for the safeguarding team is keeping the child with her parents safely. They are not taking the child from you. Involving this team is just a kind of help for you and for your dad, and his dad. Okay? So please, please avoid the way of talking that could show that you are pointing to someone who is abusing. Okay, doctors? Okay, Dr. Ahmed?
Okay.
If you use this way, definitely the mother will get angry. The mother will tell you, I'm taking my child. Then you will not have any chance to be polite with her. Okay?
Okay. So I just say
Alright?
that this is just a routine thing and everything is all right.
Yes, not everything is all right. You tell her, okay, it's a routine thing in the hospital because this is unusual fracture. It shouldn't happen to a child with this age. All right? So this is what we usually do in the hospital. Because he has a fracture, we will involve the children orthopedic team. And because this fracture is unusual, we will involve the safeguarding team.
Okay.
Okay? And don't try to tell her, we will admit your child against your will and these things. No. Okay?
All right.
Don't go into points that will make you stuck, make you get stuck. Okay?
Okay.
All right. So if I'm going to tell the mother the diagnosis in a kind of idea or a way which is not pointing to anyone, you tell her, well, Alexia, as you know that your child has a swelling in his arm, we have done X-ray, and unfortunately the X-ray showed that he has a fracture. This type of fracture, to be honest, it's unusual in this age group. It's like his arm is twisted. So it's unusual, to be honest, in his group. For that, we will need to do some actions, and they are very routine in these situations. The first one is involving the orthopedic team. to fix that fracture. The second one is involving the children safeguarding team. Children safeguarding team? Why, doctor? Are you telling me that I'm abusing my child? No, no, Alexia, at all. Sorry that you felt that way. You are caring mom. You brought him once you found the swelling. I'm not telling you that you're abusing him at all. It's just a routine thing in the hospital. Do you think that his dad is abusing him? Well, we don't know what happened, to be honest. Alexia, don't point at all. Don't point, okay? So the best thing that we can do is involving the children safeguarding team. They will find what happened and they will investigate. They will have a talk with you, and then they will do some strategies to make sure that the child is okay and safe. They are going to take the child from me, doctor. No, at all. Don't worry. The first priority for the safeguarding team is making sure that the child is with his dad and mom, but safely. Okay? Let's say the mother said to you, I'm going to take my child. Then politely you will tell her, I understand, or I can see how you are worried about what I said. It is worrisome. I know that. But believe me, we are helping you and we are helping your child. The best thing that we can do is just keeping the child or the fracture to be fixed and the team to come and investigate. Are you with me, Alexia? Stay calm, stay empathetic, stay sympathetic, stay confident. Okay, doctors? Got it? Just give me a second. All right. Any question in this case? This is a model answer, just if you want to take it. Any question, doctors? No question in this case? So I'm taking time in explaining things in each specific case because this is a skills mastering. We are trying to master our skills in this specific skill, okay? So you tell her, thank you for bringing your little boy in today. I understand. This must be very worrying for you, and I want to talk to you about the results of the X-ray. The X-ray has shown that your baby has a fracture in his upper arm, and it's what's called a spiral fracture. This type of break usually is not common in his age, and it can happen when the arm is twisted. So, when we see this kind of injury, it's important we understand exactly what happened to cause it. In situations like this, we follow a standard protocol. That means we'll need to involve a specialist team. This includes a pediatrician and sometimes a safeguarding team who are specifically or specially trained to assess injuries in young children. Okay? If she tells you, doctor, I'm leaving, I want to take my child, I know this might feel overwhelming or even upsetting, but I want to reassure you that this is about protecting your baby health. And it doesn't mean we are blaming anyone. Can you see the doctors? We're not blaming anyone. We are not pointing to anyone. We are following the protocols. Okay, doctors? Let's do the next one.
Hello?
Yeah, ready?
Yes.
Yeah, okay.
Do I start from the beginning? Like, hello, Mr.
No, just give me the diagnosis.
The diagnosis. Okay. Mr. Jack, having listened to you, I think what you're experiencing might be something we call PTSD or post-traumatic stress syndrome. Have you heard about that?
No, doctor, what is that?
That's like a sudden or acute stress due to a difficult experience that you went through, and you cannot or were not able to get past. So you keep reliving the experience and experiencing physical symptoms like the ones you've been having, like insomnia or problem sleeping and nightmares.
Okay, doctor. All right. So, is it treatable?
Um, yes, in order to help you with this problem, there are a few things that we can do, and a few things that we can try together, and others that you can do yourself. First of all, we can, since the problem with this with these symptoms that you're having is the stress that you experienced. Oh, اللي هي car accident. Oh, the accident that you had. Maybe we can start our treatment with talking about the accident with a professional. For example, we can refer you for a talking therapy with the psychologist. They will help talk you through the accident, talking about your feelings and your thoughts, and help you resolve them and make peace with them.
Okay. All right.
There are other things that you can try yourself, like relaxation techniques. Maybe try some yoga, maybe some exercise. Okay, ثاني. Oh, and for the problem sleeping, we can offer you a sleeping pill, but this would be a temporary measure, uh, maximum for maximum 2 weeks.
Okay. All right. Thank you, doctor.
Okay,
Okay.
you're welcome.
Thank you, Dr. Hind.
Thank you, doctor.
All right. So how do you feel?
I feel kind of lost. There's no structure because I didn't study this. This is psychiatry, correct?
Well, it is one, yes, it is a we can count it as a psychiatry case, or it's insomnia case, problem sleeping. Okay. All right.
So I should have talked about sleep hygiene also. So
You can talk about sleep hygiene, but what I felt, Dr. Hind, that you want to say everything that you know about this case. Okay. And this is not the issue usually in most of the cases. Okay. So the main issue in giving the diagnosis and the management is explaining the situation, explaining the medical condition, make sure that the patient understands it. All right. And then you tell him what is the first line of management in this problem. All right. Then you give the patient some time to ask his questions. I felt that you want to talk. You don't want to give time to the patient to ask.
okay.
All right. So always give a space to the patient to talk, to explain or to express his feelings, and to ask some questions. Maybe he doesn't want to take pills.
Okay.
Okay. Maybe the sleeping is not the main problem in his condition. He just wants to know what does he have. Okay.
Okay. Okay.
So always make sure that you give the diagnosis, check the understanding of the patient, and give a space for the patient to ask some questions. All right.
Okay.
Okay.
But yeah. Go ahead.
Oh, you can ask. What's your concern?
Okay, thank you, doctor. I was concerned because I didn't have any information about the patient. or the accident that happened. So I kind of had to say everything because I didn't know anything. So that was my problem. I think that's it. And I felt that the patient had nothing to say, so that's why I listed everything.
Okay. So give a time. I was about to tell you, okay, what are you going to do for me? And then you told me, okay, and for your sleeping, you can take pills. You didn't give me a time to ask my question. This is what happened. Okay.
Mm,
So
okay.
just give time to the patient to ask. This exam, to be honest, it is not 100% knowledge exam.
Mm,
It's a linguistic exam and communication exam. All right. So there is
okay.
part of knowledge. Yes, there is a part of knowledge, but the bigger part or the biggest part is the communication skills.
All right.
All right. Your way in explaining post-traumatic stress disorder was good, to be honest. You told me that what you are experiencing is something called it's better to say post-traumatic stress disorder instead of giving short term. Okay.
Okay.
Then you told me it's related to the symptoms that you have because of the accident. So your explanation was good, to be honest. All right. While you are explaining, this is what you didn't do in explanation. Just
Mm,
try to tell him that this is normal. Okay? This is normal to have
okay.
some stress after a big event that you had. Reassure
Okay.
him, okay? Reassure him that this is normal. It can happen with many people. It's common after big events like accidents, okay? Don't worry, the support is here. We can support you. We can help you. Just give him some supportive words and some, words that can show him, okay, I'm okay. It's normal. Don't worry. He can say that to himself, all right? That's why I'm
Fair,
telling
yeah.
you, it is a communication exam. It's not only a medical part. You have to be patient-centered. How to be patient-centered? To think about the patient himself. If he has a problem, he came to you because he's concerned about this. He's afraid of something. He's worried. So always reassure the patient and thank him. It's good that you came. We are here. We are going to help. The support is here. Let's talk about the support. Let's talk about how can we help. You are not alone. Okay, Dr.
Yeah, sounds good.
Hind?
And
Okay.
yes.
Yeah.
Yes. Yes.
All right. So there is a model answer here if you want. So it's completely normal to have these symptoms after a traumatic event like an accident. Sometimes this phrase is good, to be honest. I liked it. Okay, the brain continues to stay on a high alert even when the danger has passed. Okay, this can lead to a condition called post-traumatic stress disorder. These symptoms can be very distressing, but it's important to know that it is treatable. You are not alone and the support is available. Okay. So explain
Okay.
that he has PTDS, okay? And what is it? It's the stress after a big event like the accident. The patient can face some stress with flashbacks and nightmares as he has, okay? Reassure him that it is normal to have that, okay? It is common and it is treatable and we are here to support. Okay,
Okay.
doctors?
Sounds good.
Yeah.
Sounds good.
So this is the aim of our session today, to make our diagnosis firstly credible, confident, and we have a good skill in giving the diagnosis. We give the diagnosis confidently. We are able to explain everything. We are able to sympathize and empathize with the patient. We are able to make sure that the patient understands. So they give us high marks in the management. Okay?
Okay.
All right. So do you have any question, Dr. Hind?
Yeah, doctor, was the management all right?
Yeah, the management's good. What are you going to do? It's just CBT from your
Mm,
side, right? CBT, and from his side, talk about the event. Don't just try to bottle it up and just to bottle it and don't talk about it. Talk about what happened. Talk about your feelings. Talk with your friends or with people who trust them. Yoga and breathing techniques and stress managing technique. These are the things that you can talk about. You've covered them all. Nothing, to be honest. Okay, it's just CBT and relaxation techniques. Okay.
Okay. Okay,
All
thank you
right.
so much, doctor.
Thank you, Dr. Hind. When is your exam, Dr. Hind? Or
It's 16th of September.
September. Okay, you have time. So it's good, to be honest. You have too much time and your way in explaining things is good. It's just about understanding how to manage the situation and understand that this exam is not only about just reciting the facts and reciting the points that you know in your mind. No, it's about communication, being one consultation between you and the patient. Okay?
Okay.
All
Okay,
right.
doctor.
Okay.
Thank you.
Thank you. Okay, let's do the last one. Anyone wants to participate? Thank you, Dr. Daha. Thank you so much. Thank you, darling. Thank you so much. All right, let's do the next one. Who is ready? Anyone? The next one is a challenging one, to be honest. I highly advise anyone here in this session to take the opportunity to do it.
Yeah, doctor,
Okay.
I can try if nobody else wants to
All
take
right.
it.
Okay. Okay. Read the question. Not question. Read this the information, and then let's see.
So I should I shouldn't take any history from him, correct?
Nothing. It's obvious what is the problem, right?
I think so, yeah. It's all psychiatry, but I
Let's see.
think yeah.
Challenge yourself. Challenge yourself.
Okay. All right,
What?
I can start.
Okay, Jack. Let's say that the patient is Jack. Okay.
Okay. All right.
Mhm.
So Mr. Jack, what you're experiencing last
Okay.
okay. So Mr. Jack, I know it feels very real, the feeling that the police is following you. I know you've acted on this feeling and you turned yourself in.
Yes,
Uh,
doctor. They are following me. That's why I turned myself in.
okay. Mr. Jack, I know what you're experiencing is very distressing and very stressful and feels very real. But I would like to tell you that it ما ينفعش أقول له it's not real straight away, صح?
Try your best.
Okay, I'll try my best. Okay. So Mr. Jack, I know it feels real and I know it's very distressing and very stressful. But we're here to help you with that. No one is following you. The police is not following you. You did not do anything wrong.
Doctor,
You're
but they
hearing
are here outside. They are following me. I'm sure that
the
they are following me, doctor.
okay. All right. Don't worry. We're here with you and you're safe here. So even if they are here outside, you shouldn't don't worry. We're here to help you and we're here with you.
So are you sure that I'm safe, doctor? You are not with
Yes.
them, right?
No, Mr. Jack. I'm a doctor here, and you're safe with us here, and no one can do anything for you, and no one is following you here. All right?
Okay.
Are you happy to talk further about what we're going to do with you.
Okay.
All right. So, Mr. Jack, we're here in the hospital. You're going to stay with us for a while. We're going to maybe مش عارفة, give you some medications that keep you calm and
Okay.
keep you relaxed.
But I'm calm, doctor. I'm just afraid of them, doctor. I'm calm. I don't want any medication.
All right, that's okay. We might give you another medication. Uh, I'm stuck. I feel stuck. All right.
Okay, no worries. It's fine. It's totally fine. It's a challenging case, to be honest. It's a challenging case, even with the doctors who are just going to give the exam in 2 weeks or in 1 week. Okay.
Yes.
You did your best, and to be honest, I have to admit that you're brave enough to just participate to do this case.
Thank you,
Okay.
doctor.
All
Thank you.
right. So, what were the challenges that you faced in giving the diagnosis in this case, Dr. Hind?
The first challenge obviously is like, do you confront him that he's seeing things, or do you just go with it? But I think this is the management is the time to confront him that these things aren't real. Like in the
Mhm.
history, yes, we can go with the flow and just listen.
Mm-hmm.
But in the management, I think it's the time to tell him that these things aren't real.
Mm-hmm.
But I
Okay.
couldn't get myself to tell him, honestly.
All right. So the challenge was how to tell him that these feelings are not real, right?
Maybe do I tell him that the mind can sometimes make us believe that we're seeing things?
But he doesn't see. He believes. So these are not hallucinations. They are delusions.
Yeah, correct. Yeah.
Okay, so there is a difference between hallucinations and delusions. Hallucinations means the patient can feel, can see, can hear things that others cannot do. Okay, delusions means that the patient has thoughts in his mind. He doesn't see, he doesn't feel or see or hear. He just has thoughts in his mind, and he believes that these thoughts are real.
Yeah.
Okay, all right.
Mm.
Delusions, hallucinations, and thoughts problems are part of psychosis. Okay,
Mm.
psychosis is a symptom. It's not a disease. Okay.
Yeah.
Psychosis can happen in schizophrenia patients, can happen in patients who are drug abusers, can happen to patients who have psychiatry problems like what is the name? Bipolar. Okay, so it can happen in many psychiatric and mental diseases. It is not strict to be in schizophrenia only. Okay, so if you
Okay.
don't say it is schizophrenia, it's fine. I don't prefer that anyone say it is schizophrenia, to be honest. Okay, but you can say it is psychosis if you want. If you don't want to say psychosis, just at least say you have delusions. How to say that, we are going to talk about how to explain the diagnosis to the patient. So the main challenge in your case, while you were giving me the diagnosis, is how to tell him that these thoughts are not real, right?
Yes.
Yeah. Okay. Anything else was challenging?
I think having to convince him that no one is after him right now, and convincing him to accept the treatment, and maybe explain to him actually what the treatment will do.
All right. So, when you told me, don't worry, you are safe, I am a doctor, you succeeded in calming me down. Okay?
Mm.
But the medication part you didn't tell me what do I have.
Yeah.
You just told me we are going to give you medication and we are going to admit you in the hospital. You didn't tell me what's the problem with me. Is there any problem? And what is the problem? Why you want to give me medications?
Correct. Yeah.
Okay? So this is another thing. All right?
Okay.
Okay. So we have a conclusion now. What were the challenges and what did you do wrong in the case? You started by the management without giving me any specific cause for what I have. You didn't diagnose what's the problem exactly. Okay?
Yeah.
And it's a common thing, to be honest. Many of the candidates, they just jump into the management without explaining to the patient what's going on. And this is part of the process of gaining the skills, okay? If we are good and mastering everything from the start, so why do we practice? Yeah? So we are
Correct. Yes.
practicing to be good. Okay, all right. So this is a psychosis case, as we have discussed. I'm not going to dwell either delusions or hallucinations. In this case, the patient has thoughts that the police is following him, has thoughts. So it is delusions, all right? Delusions is part of psychosis. So how to tell the patient that he has psychosis and it could be a part of another disease, all right? The patient might be taking cannabis or taking heroin. Heroin and cannabis and drug abuse can cause psychosis. Okay? So,
Okay.
so you can tell him if he is taking these medications, you can tell him you have this problem and it's related to taking or using the drug streets or the recreational drugs. If he doesn't take any recreational drugs, so he has a mental problem, either schizophrenia or any other mental problem. It's not your problem. It's the psychiatry or the consultant and the mental health team problem. Okay, you are in the A&E, I think, in the case, as far as I remember. So your main treatment is a medical treatment and triaging the patient to the specific team. All right. So if you are in the A&E, you just send the patient to the psychiatry team. All right. If you are in the hospital and the patient is, or in the GP and the patient is talking to you over the phone, so you will try to explain to the patient what is the problem. And it's important to come to the hospital. If he doesn't want, so you send the home treatment team to the patient. Okay, this is if the patient is over the phone. The safest way with any psychosis patient is sending the home treatment team to the patient. Okay? All right. So how to tell the patient
Doctor, sorry, I have a question. I'm sorry.
Yeah.
I didn't understand the management part.
Okay. Well, in the management or in the cases, you will face a case which is in the A&E. You are in an FY2 doctor in the A&E department, okay, which is this case. Okay, you are in the A&E and the police brought this patient to you, to the hospital. Okay?
Okay.
Is this your case to treat as an
No.
emergency doctor? It's not your case to treat. It's for the psychiatry team to treat. Okay? So what are you going to do? You refer the patient to the psychiatry, or do you ask the psychiatry team to come? Okay?
Okay.
This is if you are in the hospital. In some cases, you will find yourself that you are in the GP and you are calling the patient upon a request from his mom or his dad or any relative. Okay? So what are you going to do over the phone. You have a psychosis patient. What is the safest thing that you can do?
Send someone.
Sending the home treatment team to the patient. This is the
Okay.
name. Home
Treatment.
treatment team or crisis team.
Yeah, okay.
All right?
Crisis.
This is the
All right.
safest thing. Okay? All right.
Okay. Okay, thank you so much.
Thank you, Dr. Hind. Okay, so this patient is in the A&E. You are talking to him, and now you are going to give him the diagnosis. Let's say that he is Jack. All right? Jack, well, thank you for all the information that you have given to me. I know how it is stressful to you, and it's worrying for you that you feel that the police is following you everywhere. This must be stressful. All right? Just let me reassure you that you are here in the hospital with us. No one is following you. We are here to help you. Okay, Jack? Okay, doctor. All right. So, Jack, I know that you have these strong beliefs that the police is following you. But to be honest, we talked with the police, and the police told us that you didn't do anything wrong and they are not following you at all. Are you with me, Jack? No, doctor, they are following me. Jack, I know that you have this strong feeling. To be honest, when you have a strong feeling or a strong belief for something that is not happening actually, this is called something called psychosis. Not psychosis, something called delusions. All right? Delusions mean that the person has strong beliefs which the others don't believe in or don't see. Okay? This is part of something called psychosis. It's a mental health problem, Jack. Are you following me, Jack? Doctor, I am not mad. I am not telling you that you are mad. I'm just telling you that you have a problem and we are here to help you. We are here to treat this problem. Okay, Jack? What are you going to do, doctor? Well, okay, the best thing for you is referring you to the psychiatry team. We are going to assess you and do some investigations. They might, okay? They might need to start you on some medications to just treat or to help you in the situation that you have. All right, so can you hear, doctor, my tone of voice? Can you see the sympathy of my tone of voice? Can you see that I'm trying to calm him? I'm trying to explain everything with him, but in the same time, I am reassuring him. I understand that these are real, and you feel that they are real, but unfortunately, they are not real. Okay, doctors? Any question? Do you feel that, no, doctor, I'm not convinced, it's not a good way? We are here to discuss. Can you hear me, doctors? Hello?
Yes, doctor, we hear you clearly. That was very
Oh,
clear.
yeah, I found it very helpful, Dr. Sahar. Thank you very much.
Okay, good. All right. So I'm going to give you another model answer, okay? And then lastly, I'm going to tell you how to explain hallucinations, okay? So this was delusions. We are going to talk about hallucinations after that. All right. If you can see, I can see that you're extremely worried that the police are following you. This must be very stressful and frightening. You express or you show that you feel what he's feeling. All right? You acknowledge that this is worrying, it's frightening. But from everything we can see, there is no sign that the police are watching you. What you are describing sounds like something we call delusion. What is delusion? A strong belief in something that others don't see or feel. This could be a sign of mental condition called schizophrenia, or could be something else. Do not say to the patient, you have schizophrenia. It could be. All right, psychosis can be a symptom for many mental conditions. Okay, doctors? You are safe here and no one is trying to hurt you. Reassure him. We want to help you feel better and understand what's going on. Okay? Staying here in the hospital will give us a chance to work together to help reduce this fear and help you feel more in control again. All right? Beside using this model answer, you have to show that you have sympathy, empathy, understanding, and supporting. Okay? You can say this, but without feelings, with monotony. I can see that you're extremely worried, Mr. X. It must be very frightening. To be honest, the police are not watching you at all. What you have is something called delusions. It could be a sign of mental health problem. Don't worry, you are safe. We are going to help you. You will be with us to treat you. Can you see can you hear the monotony? Avoid this way. Okay, doctors? All right. In terms of hallucinations, you can tell the patient. So hallucinations means that the patient hears voices or see persons or feel or can smell things that are not real. Okay? So you tell him, it sounds like you've been hearing voices or sounds that other people around you cannot hear. That can feel very confusing, Alex or Jack. Sometimes when the brain is under stress, it can make people hear things that aren't actually there. We call that an auditory hallucination or hallucinations. Don't need to explain what kind of hallucination. Okay? It's not your fault. You can use it's not your fault in the previous one. It's not your fault. It's just a symptom. Like fever or headache, and it can be treated. Okay? We are here to help. To be able to point what's the problem, we will need to do some steps. The first step, to be honest, which is important, to be seen by the psychiatry team. For that, we will send the crisis help team or the home treatment team to your house. Is that okay? Why are you going to send them? They are this team is expert in dealing with these situations. They are going to talk with you, assess the situation, trying to put some strategies. They might need to take you to the psychiatry team and then start your treatment. Okay, Jack? Yeah? Okay, doctors? So this is in terms of psychosis and delusions and hallucinations as part of psychosis. All right, any question? Any question, doctors? Everything's clear? Was it useful? Was it helpful? Did you find that after completing the session, you are able to give the diagnosis? Okay, good, thank you. Thank you, Dr. Hind. Thank you, Dr. Arij. All right, good. So I'm happy that you found it helpful, doctors. I like the skills mastering sessions, to be honest. We are, thank you. Thank you, Dr. Hind. I'm happy that you enjoyed. Yeah, thank you, Dr. Iman. We are focusing on a specific skill to master. So after completing the session, you feel yourself, okay, I can master this skill. And this is the exam. Skills, around 10 skills. If you master them, you will be able to just pass the exam with all of the simplicity. Okay? Master your skills, and that's it. The 10 skills in the skills areas, in the qualitative market domains, I think we have mastered until now data gathering. We have mastered explaining test results. We have mastered breaking bad news. We have mastered the last one was what? Nailing the first 10 seconds in the in most of the cases or in the exam. And now we are mastering giving the diagnosis, or we mastered giving the diagnosis. All right, inshallah, next month we will have another skills mastering session with another skill, inshallah, to master. All right. Okay, thank you so much for attending. Thank you so much for participating. Without your participation, the session wouldn't be helpful, to be honest. Okay, so thank you, and see you inshallah in next month, inshallah. I'm going to share the schedule for the next month soon, inshallah. And yes, have a good day. And bye-bye. Any question before I go? All right, thank you. Thank you. Yeah, thank you, Dr. Hind. You too. Bye-bye.